What is a nurse practitioner? Although the nurse practitioner comes with many different definitions, a board of nursing defines this role as a registered nurse who has earned a separate license as a nurse practitioner through additional educational experience in a distinct specialty area of practice. Nurse practitioners may diagnose, treat, and prescribe for a patient's health condition that is within their scope or their specialty of practice. This is done in collaboration with a licensed physician, qualified in the specialty involvement, and in accordance with an approved written practice agreement and protocols. How does a nurse practitioner differ from a physician assistant? By definition, a PA is a health care provider who practices medicine with a physician supervision. NPs define themselves as a nurse with a broadened scope of practice, but do not define themselves as a physician-supervised professional. PAs are never allowed to practice independently, working truly as physician extenders, whereas NPs may practice under their own license, and in some states practice independent of a physician, depending on the laws allowed in that state. Differing from a physician, a nurse practitioner does not require the exact amount of hours, education, or credentials to practice. NPs, a physician is a provider of medical care. Some differentiating requirements include their years of education, specifically in undergrad. A nurse practitioner may accomplish 2 to 4 years, with a physician requiring 4. The hours of continuing education. A nurse practitioner is required 75 hours per 5 years for continued education, whereas a physician is required 50 hours per year of continuing education. And for degrees required, a nurse must complete a nurse practitioner exam to get their license, whereas a physician must complete the MD or DO certification to practice. As for the many reasons why to not become a physician and in turn become a nurse practitioner, this includes the fact that the nurse practitioner is trained to view patients from both the nursing perspective as well as a physician perspective. Many nurse practitioners originally practice as nurses before continuing their education. That is something that I am doing. I appreciate the fact that a nurse practitioner is treating the patient as not just a patient, but also as a person, as is viewed from the nursing perspective. It is a combination of both the physician as well as a nurse that makes this role unique and for many more desirable. Thank you.